Chapter 43. Skin Conditions. The human body has been given a most beautiful covering, the skin. Nothing is more lovely and attractive than a glowing, healthy skin. All too often, though, one's appearance is marred by ugly scars and chronic eruptions, many of which need never have occurred had the skin received proper care. Skin trouble often runs in families. Consequently, members of these families need to be on guard continually. But everyone should be aware of the importance of keeping the skin healthy, for this can certainly make or mar one's appearance, perhaps for life. Your skin has several very important functions. It is your first line of defense against the germs that might enter the body. Enzymes on the surface of the skin quickly destroy germs, provided the skin is healthy and intact. But small breaks and tears in the surface of the skin may open the way to infection within the skin, and in the deeper tissues as well. Your skin has another important function: it helps to regulate the temperature of the body. When you exercise vigorously, you produce a lot of heat in the muscles. To keep the temperature of the body at a normal level, this heat must be removed quickly, otherwise you will soon have a high fever. To cool the body, large amounts of blood are rapidly sent to the skin. Many tiny vessels within the skin open up, allowing much more blood to pass through and to be cooled by the outside air. Even more important is the process of perspiration. Tiny sweat glands within the skin pour out surprisingly large quantities of water. As this perspiration evaporates, it carries off large quantities of heat, and this helps to cool the body. All of this is brought about by an elaborate system of nerves and blood vessels within the skin, under the direction of the sympathetic nervous system of the body. When the skin is cut or damaged, it usually heals quickly. This not only seals off the loss of blood, but also closes the damaged area. Itching 427. Against the entrance of germs. The healing of a wound is one of nature's great miracles. As seen under the microscope, all the cells seem to be guided by some unseen force within the body. Damaged tissues are quickly removed by the white blood cells, leaving the whole area clean and ready for the new tissues that will form. Fresh young cells now busy themselves, throwing a kind of scaffold across the lacerated area, and then rapidly filling in the spaces between and stitching together the broken edges of the skin. Soon the wound is healed, firmly cemented by scar tissue and a wall of new living cells that protect the body from further injury. Much the same process takes place when the skin is damaged by some eruption, or when some rash breaks out on the surface. For instance, chickenpox, so common in young children, first of all begins with a blister, followed by a small open sore. Within a day or two this is covered by a crust or scab, which in turn is finally replaced by normal skin. After a few months even the tiny scars are gone, unless a more serious secondary infection occurs owing to staphylococcus germs being scratched into the skin. These secondary infections usually following scratching because of intense itching, this being the most common of all skin complaints. In fact, we all have some itchy spots that we unconsciously rub several times a day. Itching. Itching is a rather unpleasant sensation which we instinctively attempt to relieve by scratching. A certain amount of mild itching is normal for everyone. Only when it is persistent and troublesome does it become serious. Many conditions contribute to itching. These include insect bites, hives, contact dermatitis, food allergies, and heat rash. Other causes may be diabetes, uremia, jaundice, pregnancy, the change of life, drug allergies, and various types of nervous conditions. Persistent scratching may produce swellings in the skin with deep scratch marks and small ulcers into which germs have found their way, causing much more trouble. Itching due to drug reactions are common following the use of certain medicines, such as aspirin, phenobarbital, penicillin, and many others. Medicines applied to the skin may also cause a certain amount of itching. Some people are allergic to nylon, others. 428 Skin conditions. To wool, and still others to dyes and various surface dressings in the cloth. Treatment: if possible, stop all medications, at least for the present. If the itching has spread over large areas of the body, try an oatmeal bath. Mix 1 cup of oatmeal with 2 cups of cold water and pour this into a tub of water. Lie in this for 20 minutes twice daily. When drying yourself, be careful not to increase the irritation. Gently pat the skin and then apply some soothing medication, such as calamine lotion or Caladryl. If the itching is severe, apply the following prescription 2 or 3 times a day as needed. Camphor 1.0 gm. Menthol 1.0 gm. Calamine lotion 100 cc. Prickly heat, skin chafing 429. If the itching is very severe, apply hydrocortisone ointment once or twice daily. This is much more expensive than the above prescription, but it will control severe itching around the rectal and genital areas, but also around the face and eyes. Itching arising from an allergic condition, such as a drug reaction, can often be relieved by some antihistamine preparations such as Benadryl, taken by mouth, the dose being 1-2 tablets or capsules 3 or 4 times a day as needed. Prickly heat. Prickly heat or heat rash is an irritating eruption of the skin due to obstruction of the sweat glands over certain areas of the body. In this condition many tiny pinhead-sized swellings occur in the skin, accompanied by severe itching. The areas most involved are the chest, back, waistline, armpits, and groins. Infants and overweight persons often suffer from heat rash. Treatment: try to avoid scratching, for this may introduce germs into the deeper layers of the skin. Wear cool, light clothing and abstain from alcoholic drinks. Oatmeal baths twice a day, as suggested on page 428, may also relieve the itch. Calamine lotion is often useful. It should be applied several times a day. Be sure to drink plenty of water during hot weather. Keep the skin clean and avoid the use of harsh soaps. Chafing of the skin. When 2 skin surfaces rub together, such as under the breasts or between the thighs, one or both surfaces may become red and irritated. This opens the way for germs and fungi to infect the skin. Burning and itching often follow, especially in the armpits, around the anus, between the fingers and toes, and in the groins. Skin chafing is always worse in those who are overweight, especially during hot weather. If the patient has diabetes, this increases susceptibility to chafing. Treatment: apply some good talcum powder several times a day. Wear cool clothing and avoid strenuous exercise in hot weather. Obese patients should definitely lose weight. Follow instructions for weight reduction as found on pages 71 and 72. Severely irritated skin. 430 skin conditions. May be relieved by applying cool, moist compresses containing a weak solution of potassium permanganate. Dissolve 1 tablet of potassium permanganate in 1 quart of water. Wring out a small compress, such as a face cloth, and apply this to the irritated area for 20 minutes 3 or 4 times a day. It is best to prepare a fresh solution each day. For severely irritated areas, apply 1% hydrocortisone ointment daily. If the condition does not readily clear up, see your doctor and be sure that diabetes is definitely ruled out. Excessive sweating. A certain amount of sweating is normal for everyone. But excessive sweating is definitely abnormal and should be investigated. Many people are troubled with cold, wet hands and feet, especially when under nervous strain. Excessive moisture on the skin always raises the possibility of further infection with fungus and bacteria, especially on the feet, around the genital areas and under the armpits. If the armpits and groins are also involved, strong objectionable odors may arise. These odors usually arise from the breakdown of sweat and cellular debris, due to the action of germs on the skin. Treatment: make a thorough search for the cause. A complete physical examination is always advisable to rule out the presence of some other disorder that should be corrected. For localized areas, apply potassium permanganate compress 3 times a day, as suggested above. Then apply some good drying talcum powder. Frequent bathing is advisable for any who are troubled with objectionable skin odors. Scrupulous cleanliness is essential to health. In some people, merely shaving the hair from under the arms may relieve this problem. For those who are troubled with persistent odors, try this excellent deodorant. Apply neomycin solution, 0.5% once or twice daily to the armpits and groins. Any good germicidal soap, such as synthol, will help to reduce the number of germs and to relieve the condition. Excessive hair. We probably spend more time on our hair than on any other single feature of the body. We are frequently cutting, shaving, curling, brushing, or cleaning it. Many of us have too little hair, others have too much in the wrong places. Baldness 431. Excessive hair growth on the face is particularly troublesome to some women. Probably some glandular disturbance is responsible, but of this we cannot always be sure. Tumors arising in the ovaries, adrenal glands, and other endocrine organs have sometimes contribute to this condition. But in most cases there is no specific cause for excessive growth of hair. Treatment: if there seems to be some underlying endocrine disturbance, this should be corrected. Excessive hair on the face can be removed by electrolysis, but this is a tedious and somewhat expensive process. There are certain chemicals that may be tried, although these often cause some skin irritation. Probably the simplest method is to shave the unwanted hair off as often as necessary, perhaps once or twice a week. This is least expensive and often makes the best appearance. Baldness. Partial or complete loss of hair on the scalp is rather common among men. This is more or less to be expected in the male, but it is very distressing when it occurs in the female. Premature baldness is a tendency in certain families. Thinning of the hair is often seen in older women, but complete baldness in the female is fortunately rare. Temporary baldness may occur following a fever or some prolonged illness. The hair usually returns after the patient has recovered from the illness. Sudden loss of hair in certain areas, a condition called alopecia areata, may sometimes follow extreme nervous shock. This may clear up in a few weeks, although sometimes it will recur. Treatment: there is no satisfactory treatment for most forms of baldness. Any irritation of the scalp should be cleared up. See Dandruff, page 443, and this may help the hair to grow again. When only small patches of baldness occur suddenly following some illness, hydrocortisone may be injected under the scalp twice weekly in the affected area, the usual dose being 5 mg. Leukoderma Vitiligo. Leukoderma or piebald skin is a distressing condition, especially in people with darker complexions. The light patches are very marked. 432 Skin conditions. This is usually not a disease. It is a cosmetic defect. However, the affected areas sometimes grow larger. In contrast to most other skin conditions, leukoderma is usually of lifelong duration. Treatment: no satisfactory method of treatment is known at present. Melatonin ointment has been used over the light patches of skin. Melatonin may also be taken by mouth, after which the patient exposes himself to sunlight. However, the regimentation of the skin is rarely complete enough to be satisfactory. Certain proprietary tanning lotions containing dihydroxyacetone may be applied to the affected areas with fair results. At least this is worth trying. Acne or pimples. Pimples are very common in young people during their teen years. This condition, which is also known as acne, is apparently due to certain hormones changes within the body. It is particularly prevalent during early adolescence, from 12 to 16 years of age, and is more likely to occur in those who have an oily skin. In the early stages, a blackhead or comedone blocks the outlet of an oil gland within the skin. This is not a serious problem, for it leaves no permanent effect. If the sebaceous duct ruptures and the oily material oozes out between the layers of the skin instead of coming to the surface, there may be a cyst or swelling known as a sebaceous cyst. These are somewhat disfiguring, but not harmful unless they become infected and form small abscesses. When these heal, they may leave ugly scars. Severe acne may occur over the shoulders, the back and chest, as well as the face and neck. Effects of diet. Acne is not caused by diet, but certain foods definitely aggravate this condition, especially in some patients. Rich foods, such as chocolate, nuts, cola drinks, ice cream, fatty meats, and excessive amounts of sugar, all seem to aggravate this condition. Certain drugs, such as those containing bromides and iodides, may also play a part in some people. Some girls develop 1 or 2 pimples just before menstruation. These only last a day or 2 and are of no consequence. But when acne continues over months or years, it is very distressing, especially to a young woman, and something should definitely be done to clear up the condition. Nervous tension due to family trouble may also. Pimples 433. Play a part in continuing this difficult problem. Even in its mildest form, acne usually persists for a year or more until the hormone system of the body has become fully adjusted. Treatment. Keep the skin clean by thorough washing 2 or 3 times a day with a good toilet soap. Some slightly abrasive soap will help to eliminate blackheads, but it should be used with care, particularly if the skin is inflamed. Smaller blackheads may be carefully removed by the use of a Schomburg loop extractor. It is better if some other member of the family does this. Warm moist towels applied to the face for 10 or 15 minutes before the treatment will make the removal of blackheads easier. If pus has formed under the skin, be careful not to open the pimple until it is ready to drain. Squeezing and pinching of the skin may extend the inflammation and delay healing, and may also cause scarring of the face. For mild infections of the face, apply white lotion once or twice daily, gently rubbing the solution into the skin. There are many. 434 skin conditions. Good commercial preparations that may also be tried. Another simple ointment that can readily be made up is Resorcinol 1.8 gm. Precipitated sulfur 3.0 gm. Hydrophilic ointment enough to make 60 gm. Apply this to the affected areas once or twice daily. Hydrocortisone lotions are also helpful, especially when combined with neomycin sulfate. Hot compresses, as suggested in the appendix, applied once or twice daily will help to relieve the inflammation. In very severe cases, X-ray therapy may be considered. This must be done only by a skin specialist using the proper equipment, otherwise it is best not used at all. In the severe cases with abscess formation, penicillin or sulfa may be tried. These will reduce the infection in the skin. Acne is always worse during the colder months. Exposure to sunlight has proved beneficial, but this should not be overdone. Moderate doses of sunshine are best. Skin that is badly scarred can be planed down by the use of a rapidly revolving instrument to which a stiff wire brush is attached. This treatment is known as dermabrasion. It can be done in the doctor's office, but should be attempted only by a qualified skin specialist or a plastic surgeon. Diet: avoid all rich foods, excessive amounts of sugar, and particularly chocolate and nuts. Choose a plain, well-balanced diet containing plenty of fresh fruits and vegetables. Drink water and fruit juices, but avoid highly sweetened drinks. Extra vitamin A tablets should be added to the diet. Try to sleep at least 8 hours every night. Avoid all nervous strain, and follow the principles of good living as far as possible, for they are essential to health. Acne rosacea. Acne rosacea is an abnormal flushing and irritation of the face and nose. It may also affect the cheeks, chin, and forehead at times. Acne rosacea occurs more frequently in middle-aged people. But there are times when it is also seen in children and young adults, particularly if there has been similar trouble in past generations of their family. Acne 435. Certain substances, such as coffee, tea, chocolate, nuts, and hot spicy foods, may be associated with this condition. Alcohol may also bring this on. Some medicines, especially those containing iodides and bromides, are likely to cause these unwanted eruptions on the face. Extremes of heat, cold, and wind may also aggravate the affected skin. Nervous tension is often a factor. The condition is really a cosmetic problem, but it is most annoying, though not really serious. Treatment: try eliminating all suspected foods and medicines for 2 or 3 weeks. Avoid coffee, tea, chocolate, nuts, and spicy foods. The use of alcohol should be discontinued for life. Impetigo. Impetigo usually occurs in infants and younger children. Certain germs infect the skin, resulting in sores all over the face and body. These crusts or scabs appear to be stuck on the skin. The disease is highly contagious, and children with it should be isolated until the condition is cleared up. Treatment: gently wash the skin with soap and water 2 or 3 times daily, removing the crusts or scabs. Then apply warm compresses of potassium permanganate solution for 20 minutes 3 or 4 times a day. Dissolve 1 5-grain tablet of potassium permanganate in a quart of warm water. Be sure to make up a fresh solution each day. Allow the skin to dry. Then apply neomycin ointment 2 or 3 times a day to each sore area. A penicillin injection given daily for 3 or 4 days will also help to quickly clear this condition. Children who are allergic to penicillin may be given terramycin or other antibiotic medicines, as suggested in the appendix. Boils and carbuncles. A boil is a tender swelling in the skin surrounded by a large red area. A carbuncle is a group of boils close together, which may later form one very large boil with several openings to the surface. Boils are particularly painful in those areas where the skin is closely attached to the underlying tissues, such as on the nose, ears, or fingers. Boils are more likely to occur in healthy young adults and teenagers. Boils or carbuncles are not only painful, but they may also 436 skin conditions indicate the presence of some underlying condition, such as diabetes. Carbuncles seem to occur more frequently in men, at the back of the neck near the hairline. Staphylococcus germs are usually the cause of boils and carbuncles. Although the condition may seem to clear up readily, it may return after the original boil has healed. The pus discharged from the boil is highly infectious, and great care should be taken to prevent the infection from spreading to other parts of the skin. Treatment: apply warm moist compresses 3 or 4 times a day over the tender area. This will help to bring the boil to a head and encourage easy drainage. The surrounding skin should be protected by applying an ointment containing neomycin and bacitracin. Large boils may need to be opened under local anesthesia, the most suitable being ethyl chloride spray. A daily injection of penicillin, 600,000 units, will help to shorten the time of infection. Other antibiotics, such as acromycin, 250 mg 3 or 4 times a day, may be bathed with liquid green soap solution and then washed off thoroughly. After drying, apply rubbing alcohol for 5 minutes 2 or 3 times a day to all the surrounding skin area. This will kill germs and prevent further spread of the infection. Very large carbuncles are best treated in hospital. All patients with boils should be tested for diabetes, especially if there is a family history of this disease. Hangnail. Infections around the nails are common, especially after improper manicuring or from wearing poorly fitting shoes. The infection may extend under the nail, causing severe pain. Unless the infection is brought under control, the condition may spread to the tendons and other nearby structures. Treatment: soak the finger or toe in hot water 3 or 4 times a day for at least 10 to 15 minutes. Apply some antibiotic ointment containing neomycin and bacitracin. If pus is present, this should be opened by doctor and proper drainage assured. In some cases it may be necessary to remove the nail completely under some suitable local anesthetic, such as Novocaine or Xylocaine. Infections 437. Beard infections. Sometimes the hair follicles of the face become infected, resulting in small tender lesions, similar to tiny boils. There may be itching, burning, and pain. Treatment: wash the face thoroughly with soap and warm water 3 times a day. With a pair of tweezers gently remove the hair from the infected follicle and apply an antibiotic ointment containing neomycin and bacitracin. Penicillin or some other antibiotic, such as terramycin, may help to clear up the skin infection. Rubbing alcohol applied to the face will help to reduce further spreads of this condition. If you have been in the habit of using a razor, you might try an electric shaver for a while. This could help to prevent infection when all other measures fail. X-ray therapy may bring relief, but this should be given only by a doctor who specializes in treating such skin conditions. Warts. Warts come in various shapes and sizes, and usually appear as rough elevations in the skin. They occur most frequently on the fingers, elbows, knees, face, and scalp. They may also be seen in different forms on the soles of the feet, and in the genital and rectal areas. Warts are apparently due to a virus infection of the skin. Treatment: although most warts are fairly easy to remove, they often tend to return, either at the same site or somewhere nearby. Ugly warts can be removed under local anesthesia by the use of an electric cautery. Certain caustic substances, such as trichloroacetic acid, may be applied every 3 or 4 days to the top of the wart. But one must avoid contaminating the surrounding tissues. Caustic solutions must be handled carefully. Fungus infections. Just as fungus lives on the bark and wood of dead trees, so certain types of fungi may also live on the surface of skin, especially in the moist areas of the body. In certain types of illness, such as diabetes and rheumatoid arthritis, fungus may attack living tissues. But this does not occur in healthy people. Fungus is found in a wide variety. 438 skin conditions. Of forms causing many different conditions. In this book, we can only briefly discuss the more common types. Athlete's foot. This form of ringworm of the feet. It is particularly common in warmer climates, and in individuals whose feet are constantly wet because of excessive sweating. When the disease is present over long periods of time, the toenails may become thickened. Treatment: bathe the feet thoroughly twice daily, dry them well, and rub away the loosened dead skin. Next, apply a suitable dusting powder containing zinc stearate or a powder containing a mixture of equal parts of zinc oxide, zinc stearate, and talcum powder. Wear light, airy shoes, especially during warm weather. Many patients benefit by going barefoot. For more severe infections, use hot foot soaks of potassium permanganate solution. Dissolve 1 5-grain tablet in a quart of warm water and soak the feet for 20 minutes 2 or 3 times a day. Whitfield's ointment applied daily has proved effective, especially for infections between the toes. Ringworm. Ringworm most commonly occurs in children, and may be seen on the trunk, extremities, or scalp. It is highly contagious and easily spreads from one child to another. The skin appears red with a slightly raised border, and the lesions seem to be continually expand. Treatment: Griseofulvin tablets 3 or 4 times a day for 1 or 2 months are often useful. Mild sulfosalicylic ointment may also be tried. Whitefield's ointment may be useful, either half strength or full strength. For more severe cases, hydrocortisone ointment can be used daily. Eczema. Eczema is a troublesome skin condition characterized by redness, cracking, oozing, and scaling of the skin. Extremes of heat and cold, and even emotional stress seem to play a part in this condition. The patient usually complains of itching and burning in the skin, especially at night. Sores appear on various parts of the body, but most often on the hands, feet, ears, and legs. Eczema may come on at any time of life and in either sex. Treatment: if the hands are involved, wear cotton gloves. Avoid the use of all harsh soaps and chemicals. Apply silicone protective. Itch 439. Cream 2 or 3 times a day to irritated area. Emotional upsets should be avoided as far as possible. It is most important to be sure the patient does not have diabetes or some other disease. Hydrocortisone ointment, 0.5%, is often helpful. If there is marked swelling under the skin, a few injections of penicillin may be needed to clear up the infection. But one must be sure the patient is not sensitive to penicillin or any other medication. Scabies or itch. This intense form of itching, caused by a tiny creature known as the itch mite, has been known for centuries. It rarely occurs in those who live in a good hygiene environment. But under war conditions or other forms of disaster, when large numbers of people are displaced from their homes and crowded together under unhygienic conditions, scabies may become a real problem. The female itch mite burrows under the outer layer of the skin, depositing her eggs along the tunnel. Within a few days of the larvae hatch and then tend to congregate around the hair follicles of the skin. Scabies is readily transmitted from one person to another. Therefore, whenever a genuine case of scabies occurs, the whole family should be treated. The itching is usually worse at night. Often it involves the genital areas, as well as the spaces between the fingers, the front surface of the wrists, around the elbows, under the armpits, around the nipples, along the belt line, and on the lower part of the buttocks. The burrow made by the itch mite appears as a fine, wavy, dark line. If needed it can be seen at all. Often there is swelling, as well as scratch marks and local eczema over the irritated areas, and this may cover up the tiny tunnels so that they will not be seen. Treatment: soak the whole body for at least 20 minutes in a hot bath, using plenty of soap. Pay particular attention to the itching areas, scrubbing them thoroughly. Next, apply a 25% emulsion of benzyl benzoate. Cover the entire body with this solution, from the neck down to the toes, both back and front. Repeat this next morning. All the underclothing should be given thorough laundering, and the outer garments should either be dry cleaned or pressed with a hot iron. Pay particular attention to the seams while doing this. The heat will kill any parasites present in the clothing. If the benzyl benzoate emulsion is not available, apply sulfur. F29. 440 Skin conditions. Ointment to all the body, rubbing it in thoroughly after a hot bath. Use 10% sulfur ointment for adults, and 5% for children. Apply this on 3 successive nights. Calamine lotion will help to control the itch. Try not to scratch the skin. For badly inflamed areas, apply neomycin ointment containing cortisone. Make sure the bedding is also thoroughly cleaned and laundered. Treat every member of the family at the same time, and clean the house thoroughly. Lice infections. 3 main types of lice may affect the human body. One type attacks the scalp and head, another attacks the body, and the third attacks the genital areas, and occasionally the eyebrows and eyelashes. The parasites may also be found in the seams of clothing. In the hair, small oval-shaped nits may adhere to the hair shafts in great numbers. These are often difficult to remove. In a few days they mature, becoming fully grown lice. Itching is usually severe, and the skin shows evidence of much scratching. Body lice are common in people who are crowded together and living under poor sanitary conditions. They spread rapidly during wars and other disasters. At such times lice will sometimes transmit serious conditions such as epidemic typhus, trench fever, and relapsing fever. These diseases are discussed elsewhere in this book. The itching is intense, and red bee bite marks may even be seen in the skin. Treatment: thoroughly cleanse the whole body from the scalp to the toes, using plenty of soap and water. Next, apply 5% benzyl benzoate emulsion to all the itching areas. Rub this well into the scalp at night, especially if the hair has been invaded by the parasites. Dust the skin with 5% DDT powder, especially Indiana, the areas where the parasites are found. Thorough laundering of the underclothing and dry cleaning of the street clothes will help to get rid of these pets. Apply a hot iron along the seams and over all the outer clothing. All members of the family should be thoroughly examined and given the same treatment if necessary. Toilet seats and other sources of infection should be examined and thoroughly cleaned. If the eyelids and eyelashes are invaded by the parasite, apply 1% yellow oxide of mercury ointment several times a day. Dermatitis 441. Contact dermatitis. Contact dermatitis, also known as dermatitis venenata, is an inflammation of the skin due to contact with some particular substance to which an individual may be sensitive. The many different substances causing this dermatitis may be contacted from various plants, or from such substances as hair dyes, bleaches, skin tonics, nail polish, perfume, wool, silk, nylon, floor wax, and various detergents. Today many new industrial compounds are being produced for industry or medicine, so we cannot always tell the exact cause of the trouble. Insecticide sprays may cause a widespread inflammation which usually disappears within a few days when the cause is removed. If the inflammation continues for a time, it may be followed by temporary thickening of the skin. Normal skin is able to resist most of these harmful substances, but some types of skin are very sensitive. A person may be sensitized after only 1 or 2 exposures. Lighter-skinned people seem to suffer more frequently. Any part of the body may be affected, but certain parts are more likely to be involved. These include the sex areas, and exposed areas as, the eyelids, forearms, face and neck. Treatment: no treatment is effective until the offending agent is removed. This is not always easy, but a serious attempt should be made to find and eliminate the cause, if at all possible. In severely inflamed skin, apply moist warm compresses of potassium permanganate solution. Make up this solution by dissolving 1 5-grain tablet in a quart of warm water. Moisten the compress and wring it out thoroughly, then apply to the irritated area. Repeat this 2 or 3 times a day as needed. If the dermatitis is very severe, give 40 units of ACTH daily by intramuscular injection for 2 or 3 days. Oral prednisolone, 5 mg 4 times a day, may also be given at the same time. Usually when the cause is removed, the condition clears up quickly. Neurodermatitis. Neurodermatitis is a chronic type of itching and inflammation of the skin. The itching area may be in some localized spot or it may. 442 skin conditions. Extend over large areas of the body. The condition may even develop in infants. It may disappear after the age of 2, only to return in the early teens or later. The condition is more often seen in those who suffer from fever, hives, and asthma. The true cause is hard to find, for most of these people are allergic to many things, particularly when they are nervous and upset. Many of them are tense and restless and are troubled with a dry skin. They are hypertensive and are often given to itching, especially in the bend of the elbow or behind the knee. The constant scratching leaves deep scratch marks and causes thickening and furrowing of the skin. Treatment: apply some simple ointment to the affected area 2 or 3 times a day as needed. Rosewater ointment is excellent for this purpose. Another prescription that might be tried is aluminium acetate solution 10.0 cubic centimeters. Wool fat 20.0 gm. Zinc oxide paste 30.0 gm. Apply to the itching area 3 times a day as needed. For more severe itching, try hydrocortisone ointment. This is expensive, but it is often more effective during the severe stage. Apply only small amounts and rub in thoroughly. Benadryl and other antihistamines may be given by mouth 3 or 4 times a day to relieve the itching. Often a change of climate is beneficial. Air conditioning could also be helpful. Above all, try to remove all causes of tension and nervous agitation, for although these may not be the cause, they always aggravate a case of neurodermatitis. Equinol, meprobamate, 400 million guaranis can be taken 3 or 4 times a day to control the nervous agitation. Seborrheic dermatitis. Seborrheic dermatitis is a chronic inflammation of the skin most frequently seen on the scalp. The true cause is not known. Inflammation may begin on the skin behind the ears. Later the whole scalp may be involved, including the external ear canals. From there, it may spread to the eyebrows, the folds of the nose, and the front of the chest. Reddish, scaling patches may also appear under the breasts and in the body creases, especially around the groin and dandruff. 443. Anal areas. Whenever this occurs, a careful study for diabetes should always be made. Treatment: apply some suitable lotion or ointment, such as the following: Resorcinol 4.0 gm, salicylic acid 4.0 gm, glycerin 4.0 cubic centimeters, alcohol 70% to make 240 cc. Apply this to the scalp each day for 1 week, after that once a week as needed. A proprietary preparation, known as Selsun, will also help to clear this infection. Wet the scalp, then pour a small quantity of Selsun into the palm of your hand. Dip your fingers in the solution and apply them to the scalp and roots of the hair. Leave the Selsun on the scalp, then use your regular shampoo, washing the hair thoroughly. Repeat this treatment twice a week as needed. Another useful preparation is salicylic acid 1.8 gm, precipitated sulfur 1.8 gm, hydrophilic ointment to make 60 gm. Apply this daily to the scalp as often as needed. Very severe cases of seborrheic dermatitis may respond well to hydrocortisone ointment. In folds where moisture is likely to gather, apply talcum powder and keep the skin dry. Overweight patients should definitely lose weight. This will improve their health, and at the same time help to clear up the dermatitis. Dandruff. The term dandruff includes several different conditions of the scalp. In the milder stages, there is scaling in which the entire scalp may be covered with loose dry scales. When the hair is combed or brushed, or when the scalp is scratched, these scales fall like snow on the shoulders. Often there is itching as well, and the scalp may be red from scratching. 444 Skin conditions. What is at first thought to be dandruff may later prove to be some other condition, such as seborrheic dermatitis, mentioned above, or worse still psoriasis, see page 445, and even neurodermatitis, which is discussed on page 441. Treatment: if the scalp is covered with greasy scales, wash the hair thoroughly every day, using some good soap or medicated shampoo. Frequent washing will not harm the hair. If necessary, you may use this good cleansing preparation. Resorcinol 4.0 gm, salicylic acid 4.0 gm, glycerin 4.0 cc, alcohol 70% to make 240 cc. If there are red patches with bright, silvery scales on other parts of the body, such as over the knees or behind the elbows, the trouble may be due to psoriasis. The treatment for this is suggested on page 445. For every persistent lesions, apply hydrocortisone cream 1% daily as needed. Itching lesions of the scalp are often due to neurodermatitis, especially when it occurs on the back of the head. Apply 1% hydrocortisone cream daily to the itching area. Injections of hydrocortisone into or under the skin may also help to clear up the more persistent areas of irritation. Summary: keep the hair and scalp clean by frequent shampoos. Clean your comb and brush after each use. Follow the directions suggested for more stubborn cases of dandruff, and don't scratch. Drug eruptions. Inflammation of the skin may occur after the use of certain drugs, particularly in those who are troubled by other allergic conditions, such as asthma, hay fever, and hives or localized swellings of the skin. Penicillin reactions are common. There is often a widespread rash. Medicines containing bromides and iodides may also cause a rash, and even small pustules may form in those who are allergic to these drugs. Cortisone in some people may give strange allergic reactions in the skin and in other parts of the body. Treatment: most drug reactions in the skin will quickly subside after the offending drug has been discontinued. If the rash is severe, 1 or 2 injections of ACTH may help to clear it up, the usual dose. Psoriasis 445. Being 40 units given intramuscularly. Patients with severe skin reactions may need to be treated in hospital, where intravenous therapy is readily available, and the patient's general condition can be watched for any unfavorable reactions. Psoriasis. Psoriasis, a chronic skin condition, usually extends over many years. Sometimes it seems to clear up for a while, only to return later. The affected skin appears red and irritated and may be covered with bright silvery scales. Usually there is little itching. Areas most likely to be involved are the scalp, the skin behind the ears, the front of the knees, behind the elbows, and the lower part of the back. Other parts of the body may also be affected. Except for the irritated skin, the patient usually feels quite well. Even the hair growth does not seem to be affected. In a few cases, the patient may complain of arthritis in the fingers or toes. Treatment: remember, this is a chronic condition. Sometimes it responds quite well to some new medicine and may even disappear for a while, only to recur later. Sunlight in moderate doses is beneficial in most cases. The patient should have adequate rest and a well-balanced diet. Every effort should be made to relieve all nervous tension, for this is often a factor. Here is a useful prescription that may be tried. Salicylic acid 0.6 gm. Ammoniated mercury 0.6 gm. Hydrophilic ointment, to make 30 gm. Apply this twice daily to the affected areas. Injections of hydrocortisone into the skin, given immediately beneath the lesions, may also help to clear up this troublesome condition. Leprosy. Leprosy, or Hansen's disease, has been known since early times. However, many other chronic conditions affecting the skin, such as tuberculosis, psoriasis, leukemia, and scurvy may have been confused with leprosy in the past. True leprosy as we understand it today is a mildly contagious disease caused by a rod-shaped germ. The disease is 446 skin conditions. Now found mainly in warmer climates and is of two distinct types, one largely affecting the nerves, the other being found mainly in the skin. The cutaneous or skin type of leprosy begins with small, light red, or purple, pimple-like lesions that spread in clusters, giving a lion-like appearance to the face when found there. Small nodules may appear on the eyelids, and may occur inside the nose, causing occasional bleeding. The nerve type of leprosy may cause anesthesia or a lack of feeling in the involved limb or area of the body. Sometimes there is a painful type of neuritis. At other times the hands or feet may be deformed. Ulcers may appear on the affected area, especially on the toes, often leading to the loss of several toes and perhaps a whole foot. Prevention: all patients with leprosy should be isolated during the acute stages. When the disease is brought under control, isolation is not usually necessary. Treatment: the sulfone drugs are most widely used today. Dapsone should be given twice weekly, beginning with doses of 100 mg by mouth the first week, 200 mg the second, and 300 mg twice a week thereafter. Sulfoxone sodium can also be given orally, beginning with 0.3 gm daily for the first week, 0.6 gm for the next 3 weeks, then 1.0 gm per day as needed. Local public health authorities may wish to institute a different program, which may be more desirable in certain areas. Bed rest may be advisable during the periods when the patient is suffering from fever during lepra reactions. Prednisolone will often bring relief during severe crises, the dosage being 5 mg 2 or 3 times a day until the patient improves. Sulfadiazole ointment, 5%, will often help to heal large ulcers. Lupus erythematosus. This is a chronic disease of the skin that sometimes also involves the mucous membranes and other tissues of the body. The true cause is not known. Lupus erythematosus is more common in women between 20 and 40 years of age. Small reddish patches appear over the sides of the face, under the eyes, and over the bridge of the nose, also behind the ears and on the scalp, the so-called butterfly lesion. This is more noticeable after exposure to sunlight. For this condition a right corns and calluses 447. Diagnosis is most important. Not only must the appearance of the skin be carefully observed, but various tests should also be done. Treatment: direct sunshine should be avoided as much as possible. Some useful anti-sunburn lotion or cream should be applied to the irritated skin whenever one has to go into bright sunlight. Chloroquine phosphate, 500 mg per day for 2 weeks, followed by 250 mg a day for the next 2 or 3 months should be tried. The lesions can also be partly covered by a soft tinted ointment made as follows. Boric acid ointment 30 gm. Rose water ointment 30 gm. This should be applied to the skin daily to keep the lesions of the face soft. A more serious form known as systemic lupus erythematosus OC occurs when the disease involves the heart, kidneys, lymph nodes, and spleen. The patient may complain of fever, loss of weight, vague joint pains, attacks of pleurisy, abdominal pain, and in a few cases the typical butterfly pattern of lesions on the face. There may be pains in the joints at times. This is a serious condition requiring the care of a well-qualified physician. Fortunately, it is rather rare. Patients with this disease must avoid physical exhaustion and all nervous strain and tension. ACTH and cortisone will often help to control the symptoms. The patient should be on a balanced diet and be given blood transfusions if he becomes anemic. Corns and calluses. Corns are painful thickenings of the skin usually found over the joints of the toes and on the soles of the feet. They are tender when touched, and often result from wearing badly fitting shoes. Calluses are similar to corns, except that larger areas of the skin are involved. In these the skin itself is not so tender but is greatly thickened by the extra use, such as on the soles and heels of the feet. Any undue pressure on the feet may produce a corn or callus. Treatment: try to eliminate excessive pressure over the area by wearing softer, better fitting shoes. Also, apply a small piece of moleskin plaster or bandage to prevent any undue soreness and thickening of the skin. Thickened skin may also be softened and removed by painting the area each night with the following solution. 448 Skin conditions. In using this solution, care must be taken to avoid injuring the surrounding skin. Thickened skin may also be filed down by using a nail file or a piece of emery paper. Pads or rings of various shapes and sizes may be placed over the area so that only a little pressure will be felt over the affected spot. Many people can be greatly helped by seeing a chiropodist. However, patients with diabetes or hardening of the arteries should also seek advice from their own family physician. Bedsores. A bedsore, decubitus ulcer, occurs when the skin over some bony prominence breaks because of prolonged pressure over the area. This is most likely to occur when an elderly patient has to spend a long time in bed, such as after a stroke or perhaps a spinal cord injury. These chronic sores are usually found over the lower parts of the back, and over the bony prominences of the legs and ankles. Pressure over the skin cuts off the local blood supply, causing necrosis and gangrene. Because many of these patients are already in poor physical condition, bedsores are a problem in nursing, especially if the patient is unable to control the urine or feces. First signs of trouble are increased redness of the skin, which may later turn darker owing to local cyanosis. Small blisters may also be present. Eventually the surface of the skin breaks down and an ulcer develops which tunnels through the skin and into the deeper tissues, such as muscles and even the bone. Once the skin is broke, infection. Preventing bedsores 449 sets in, and the ulcer may continue to spread and burrow under the skin in different directions. Prevention: bedsores and decubitus ulcers are easier to prevent than to cure. Therefore one must take precautions to avoid injury to the skin. Turn the patient from side to side every hour to prevent long periods of pressure over the same area. Use small foam rubber pads to protect these areas. Fluff pillows and rolled blankets should be placed under the knees so that the pressure will come on the bottom of the heel instead of on the back of the heel where the ulcers are more likely to form. Keep the patient's bed clean and free from wrinkles. The sheets should be tightly tucked in under the mattress. Remember that small hard particles may easily injure the skin. Crumbs should not be allowed to remain in the patient's bed. Keep the skin clean and dry at all times. Change the bedclothes frequently. Good skincare is most important in preventing bed sores. Sponge the skin, especially in hot weather, thoroughly drying it after each bath. Then apply rubbing alcohol to keep the skin surface hard. Finally, use a dusting powder containing talcum or zinc stearate, or use a silicone spray to protect the skin. This is particularly important in those areas where pressure is likely to be felt. Remember, elderly patients do not always feel pain. Therefore, you must anticipate their needs and provide the best nursing care possible. When the patient is unable to control his urine, it may be well to consider using an indwelling catheter. Always change the dressings frequently and keep the patient dry. Treatment: in treating a bedsore, continue to follow the suggestions just made. Stimulate the circulation around the area by gentle massage and infrared radiation. A heating lamp is always useful for 450 skin conditions. Any patient who must remain in bed for any length of time. Apply compound tincture of benzoin to the irritated skin area or else use a silicone spray. Zinc oxide ointment should also be applied to the ulcer. Be sure the patient has a well-balanced diet with plenty of protein and also extra vitamins. Carefully remove any dead tissue inside the ulcer, leaving the area open to the air. Then place a heating lamp at a suitable distance to avoid burning the skin. Certain enzymes, such as trypsin, may be applied in the form of dry powder or in wet dressings. Ointment containing 5% neomycin and bacitracin is also of real value in this condition. If an abscess develops, the patient should be given penicillin injections daily, or else some other antibiotic, such as terramycin by mouth 3 times a day. Nothing is more difficult to clear up than a chronic bedsore. Therefore, everything possible should be done to prevent bedsores before they start. Moles and birthmarks. Moles are small pigmented tumors, consisting of clusters of nevus cells containing melanin, a special pigment of the skin. Moles vary a great deal in color, some being yellow or brown, and others purple and black. They may be large or small, flat or raised, smooth, hairy, and some even have the appearance of warts. Some moles stand out on small stalks. A few moles may be present at birth and are known as birthmarks. Occasionally a mole may become malignant, a condition known as melanoma, a particularly dangerous form of skin cancer. Ordinary moles are usually benign, and the chance of their developing into malignant tumors is very slight. But a special kind of mole called a junction nevus may appear like any other mole, and yet it can become highly malignant. Any mole that is growing rapidly and turning a darker color may be malignant and should be removed. Treatment: most moles can be left entirely alone. However, many people prefer to have them removed for cosmetic reasons, and this is quite understandable. If a mole is removed, it is always wise to have the tissues studied by a pathologist. The complete mole should be removed at the time of surgery to prevent any pre-malignant mole from becoming malignant. If a mole is definitely suspected of being malignant, the lesion should be widely excised, by either a surgeon or skin specialist. Any mole changing color should always be removed. The same is true of bleeding of ulcerated moles. Skin cancer 451. Generally speaking, malignant melanomas are more likely to develop in the legs. Moles that are constantly subjected to irritation as from belts or tight bands are always more likely to undergo malignant change. Such moles should be removed. As a rule, if there is hair growing out of the mole, it is not likely to be malignant. Usually there is no danger in removing such moles by surgery or electric cautery for cosmetic reasons. Skin cancer. Skin cancers occur most frequently on the face, especially in people who are exposed to large amounts of sunshine. Too much sunshine can be dangerous. Outdoor workers and sunbathers need to be careful, for it is easy to develop a skin cancer. Light-skinned persons are even more sensitive. However, cancer may occur in anyone regardless of color or age. X-ray and radium burns may also result in malignant tumors, which may occur several years after the overexposure to the radiation. Basal cell epithelioma. This type of skin cancer usually develops in middle and later life, and is most often seen on exposed areas, such as the face, nose, or forehead. The original tumor looks like a small pimple which enlarges slowly. After a few months it looks like a shiny swelling in the skin with a hollow center. This little tumor then begins to spread over the surface of the skin. Growth is slow, but the cancer may be burrowing down in the deeper tissues. Surgery, removal of the entire tumor, is the method of choice in treating this condition. Squamous cell epithelioma, also known as epidermoid carcinoma, is more likely to develop in older people. This type of cancer tends to show the natural changes due to age. At first it looks like a small patch, perhaps on the lips or tongue. After a few months it may begin to grow rapidly, spreading over the surface of the skin and down into the tissues. An ulcer may form, undermining the surrounding skin, and leaving a hard ragged edge. This tumor is particularly dangerous. It should be removed as soon as it appears. As in all other types of cancer, once the tumor is removed, it should be carefully studied by a qualified pathologist. Remember, any sore that does not heal after 2 or 3 weeks should be considered malignant until proved otherwise.